थे टारगेट एम्स जोधपुर चैनल में। आज हम पढ़ेंगे पीडियाट्रिक नर्सिंग, जो कि वेरी इंपॉर्टेंट है फॉर नॉर्सेट प्री एंड मेंस। पीडियाट्रिक इज़ द ब्रांच ऑफ मेडिकल साइंस विच डील विद द चाइल्ड ग्रोथ एंड डेवलपमेंट, देयर इलनेस एंड ट्रीटमेंट। जो पीडियाट्रिक नर्सिंग है, इसमें ये अब समझ में तो आ ही गया होगा कि ये मेडिकल साइंस की है और इसके अंदर चाइल्ड की ग्रोथ एंड डेवलपमेंट के लिए बात की जाती है, ठीक है। और ये जो वर्ड है पीडियाट्रिक्स के फादर किसको बोला जाता है? एब्रन जैकोबी। किसको बोला जाता है? एब्राहम जैकोबी। किसको बोला जाता है? एब्राहम जैकोबी। किसको बोला जाता है? एब्राहम ABRAHAM एब्राहम जैकोबी, ठीक है, याद रखना। ग्रोथ इज ए इंक्रीज इन फिजिकल साइज और मास ऑफ द टिश्यू। डेवलपमेंट इज ए फंक्शन एंड फिजियोलॉजिकल मैचुरेशन। ट्राइसोमी 21 इज द डाउन सिंड्रोम। ट्राइसोमी 18 हैवार्ड सिंड्रोम। ट्राइसोमी 13 इज ए पटाउ सिंड्रोम। 21 यानी डाउन सिंड्रोम, 18 यानी हैवार्ड और 13 मीन्स पटाउ सिंड्रोम। 1 क्रोमोसोम इज ए एब्सेंट इन फीमेल, टर्नर सिंड्रोम। Prenatal period is the 22 week of gestation to the 7th day of birth. The first assessment of the newborn is initiation of the respiration. The ABGAR score is given by Dr. Virginia ABGAR. Is done 1 lead 5 minute. Minimum ABGAR score is 0 to 0 and max is 10. Suction of the newborn first is oral and then nasal. Suction pressure is 40 to 60 mmHg for term babies. 80 term babies में हम कितना करेंगे? 80 to 95 और फॉर चिल्ड्रन में हम 80 to 120 और अडल्ट में देखो सक्शन प्रेशर 40 से 60 लगाते हैं ट्रम में और चिल्ड्रन में लगाते हैं 80 से 95 और ट्रम में लगाते हैं, एडल्ट में लगाते हैं 80 से 120। याद रखना। ड्यूरेशन ऑफ द सक्शन शुड बी नॉट एक्सपेंड 10 to 15 सेकेंड। विटामिन के इंजेक्शन 0.5 mg प्री ट्रम में लगाते हैं और 1 mg ट्रम में टू बी गिवन IM इन द वेस्टस लैट्रियस मसल्स lateral aspect of the thigh. Breastfeeding should be as soon as possible in normal delivery. In case in cesarean section delivery, breastfeeding should be 4 hours. Healthy newborn का टेम्परेचर होता है 36.5 से लेके 37.5 डिग्री और फ़ारेनहाइट में 37.799.6 फ़ारेनहाइट। पल्स होती है 120 से 160 पर भी। रिस्पायरेशन होता है 30 to 60 बीट पर मिनट, ठीक है। और ब्लड वॉल्यूम होता है इसका 80 ml पर kg। लाइफ स्पान ऑफ द RBC 80 डे। हीमोग्लोबिन होता है 18 से 20 mg पर DL। फिजिकल पैरामीटर्स ऑफ नॉर्मल न्यूबॉर्न का वेट होता है 2.5 से लेके 3.5 kg। लेंथ होती है 48 से लेके 53 सेंटीमीटर। हेड सर्कमफ्रेंस होता है 33 से लेके 35 सेंटीमीटर। चेस्ट सर्कमफ्रेंस होता है 30 से 32 सेंटीमीटर। आफ्टर 1 year ऑफ द लाइफ हेड सर्कमफ्रेंस और चेस्ट सर्कमफ्रेंस इक्वल हो जाते हैं। मिड अपर आर्म सर्कमफ्रेंस इज 11 to 12 इंच सेंटीमीटर। BMI वेट इन kg अपॉन हाइट इन मीटर 2। वेट गेन अप टू 6 मंथ कितना हो जाता है? 20 to 30 ग्राम पर डे। 6-12 मंथ 10 to 15 ग्राम पर डे। वेट 6 मंथ इन डबल ऑफ birth. After triple 10% weight is lost in first 7 days of life. After birth that regain by 7 to 10 days. First teeth appear id lower In season, it's 6 months. It's 6 year. First percent pre pre prematern teeth erupt in first molar teeth 6 month पे. Delayed dentition is caused by Seritism. Low set ear is ear below immigration line from outer canthus of the eye found in Down syndrome. Erythromycin is drug of choice in Chlamydian ट्रोकोमाइटिस. इरिथ्रोमाइसिन ड्रग ऑफ चॉइस किसकी है? इरिथ्रोमाइसिन ड्रग ऑफ चॉइस कैलोमाइसिन ट्रोकोमाइटिस. अम्बिलिकस इज एएसएस ओमेलोअस. अम्बिलिकस इज एएस ओमेक्लस. इन पीमोइसिस force skin is not retreat on glass penis is correct by circumference done it 16 to 18 month. Epispatis is urethral opening. देख, पियोमेसिस का मतलब होता है जो फोर स्किन होती है ना, नोट रिट्रेड, पीछे नहीं जाती है. नोट रिट्रेड ऑन द ग्लास पेनिस इज करेक्ट बाई सिस्कोमेसेशन के द्वारा उसको करते हैं. 18 से 6 मंथ पीछे नहीं जाती, उसको बोलते हैं फिलोमाइसिस. और इपीस्पाइडिसिस का मतलब होता है जो यूट्रल ओपनिंग होती है वो डोर्सल सरफेस पे होती है. हाइपोस्पाइडिसिस का मतलब होता है यूट्रल ओपनिंग इन द वेंट्रल सरफेस यानी कि नीचे डोर्सल. मिलाना इज ए पिन पॉइंट. मिला इज pinpoint whitish purple found on the forehead, nose, cheeks and they disappear within 2 से 4 weeks. Mangolian spot are bluish. Black spot are found on lumbosacral region and disappear in 1-2 year. Rooting reflex, scanning reflex. Rooting या scanning reflex if examiner finger placed of the corner of the lips then babies, इसको बोलते हैं rooting reflex. Hand is turned to the side. Head in turn to the side is disappear 3 to 4 months. Memenogenesis growth and development of the breast. Lactogenesis is synthesis of the secretion of milk. Galactokinesis is ejaculation of the milk. Lactogalaxosis medication increase formation of the milk. Sulfuride in drug of choice. Bromocriptine is drug of choice for lactation suppression. Prathapexia is a inability of the newborn to inhalate spontaneously certified respiratory with 1 minute of the birth. If heart rate of the newborn is below 60 then start CPR. Component of KMC are skin to skin contact and exclusive breastfeeding. Neonate jaundice is etiologies discoloration of the skin, sclera, mucous membrane and nail due to increased serum bilirubin level 5 mg per dl. Most common cause of the hemolytic newborn is RH incompatibility. हेमोलाइटिक मोस्ट कॉमन क्या है? RH इनकम्पेटिबिलिटी. पैथोलॉजिकल जॉइंटिस अकर इन विद इन 24 आवर आफ्टर डिलीवरी or physiological jaundice occur after 24 birth of 27. Kernicus is pathogenesis condition in which uncontrollable bilirubin entry to birth. Cactus is loss of the birth with severe muscle wasting. Cover the eye to prevent retina damage and genital organs to prevent golonal damage. Every 2 hours monitor temperature changes, position and breastfeeding during phototherapy. Phenobarbital is drug of choice for phenobarbital is drug of choice jaundice. Loading dose is 15 to 15 mg kg per day. Maintenance dose is 4 to 5 mg kg per day. Blood transfusion is body affected by neonate jaundice is to be 160 to 180 ml per kg. It can be transfused by umbilical vein for 7 days after birth. During blood transfusion after 50 ml transfusion, administer 0.5 ml calcium gluconate to prevent hypoglycemia. Low birth weight babies is mainly preterm babies that delivery before 37 week of shift SARF shift sign prematurity infant eyebrow close the body midline without resuscitance as the examiner down the arm across the chest to the opposite shoulder, sign of the prematurity baby. Premature babies having suture and frontalness with widely suppressed deep crease over palm and sole, vericillate and hypothermic skin. Most important aspect of hand washing is friction. Baby born after 42 hours is termed as post-maturity baby. Characteristics of post-term babies: hypoglycemia, uh, percaminate-like skin, dry, cracked without lingo and fingernail are long. Blood sugar level decrease 40 mg per dl in newborn is termed as hypoglycemia. 8-day disease scano as a tetanus, neonatism, infection of umbilical stum after birth by Clostridium tetani. First symptoms develop after 7 days of birth. Look, jaw or teritimus. It is the tonic spasms of jaw muscles due to disturbance in trigeminal nerve. Jaw is unable to open. Rise scandius is acute facial spasm with rise lip to expected to teeth lock like switchpad smile. Opistolious bodies become like arachnoid. Prevention of neonatism. Tetanus is active immunization of the pregnancy woman with 2 TT injection administered. Woman tetanus antitoxins 500 unit. Characterized of newborn from a diabetes mother, hypoglycemia, hypobilirubinemia, hypocreatemia, thrombocytopenia, hypocalcemia, hypomagnesemia, CHD and RDS. Assess respiratory status and blood glucose level. Newborn after HEPB mother should be get hepatitis B immunoglobulin within 12 hours of the delivery. Breastfeeding is allowed if newborn is vaccinated, breastfeeding for newborn babies from Y positive, HIV positive mother is not contraindicated but restated. PEM Meramus is more commonly found in infant. PEMs protein energy malnutrition कासीगर is more commonly in preschool. इनफैक्ट में तो होता है मेरामस और जो प्री स्कूल बच्चे होते हैं उनमें होता है कासिकोर. वाइब्रियो कोलेरा इज कोजेसिव एजेंट फॉर कोलेरा. कोलेरा के लिए कौन होता है? वाइब्रियो कोलेराइस. क्लिनिकल मैन्युफैक्चर्स क्या हो जाएंगे? राइस वाटर स्टूल. साल्मेनो टाइफाइड इज कोजेस एजेंट फॉर ट्रोफाइड फीवर. क्लिनिकल मैन्युफैक्चर पीस ऑफ स्टूल. Component of ORS is NaCl. NaCl 2.6 gram or KCI 1.5 gram. Nitrite citrate होता है 2.9 mg. ग्लूकोज होता है 13.5 mg. वाटर होता है 1 लीटर. क्लैप लिप इज incomplete fusion of lip. Incompleted fusion of both hard and soft palate is cleft palate. VSD is most common anomaly found in cleft lip and cleft palate. Difficulty in suctioning. Difficulty in sucking is most common in cleft lip. Dysplasia is commonly in cleft palate. Dysplasia होता है क्लैप्ट पैलेट में और सक्शनिंग में प्रॉब्लम होती है क्लैप्ट लिप में. हेलोप्लेस्टिया सर्जिकल रिपेयर ऑफ लिप इज डन इन 3 to 6 months with G techniques to prevent laceration. Provides supine and lateral position opposite to surgical site. Palastoplasia. Palatoplastia surgical remove of palate done it 12 to 18 months. Provide prone position after surgery. Post-operatively advised to avoid crying. First symptom of esophageal atresia and TEF is salivation with drooling and frothing with coughing, choking and cyanosis, and main symptom TA and TEF. Esophageal dystocia and diagnosis is done by insertion NG tube, failure to forward transfer. Maintain NPO to prevent aspiration and upright position for EA and TEF patient. Hypertrophic pyloric stenosis, narrowing of pyloric canal and sphincter due to hypertrophy of circular muscles. Clinical manifestations are projectile vomiting, abdominal palpitation of the oval shape, mass, and management is done by pyloromytoma Fridus remedies aspiration. Nursing responsibility for PES is to prevent from aspiration. Pyloric stenosis में aspiration, feeding, upright position, absent of ganglionic nerve is some part of the intestine, so there is not persistence movement in the affected part. Is canoes Hirschsprung disease, megacolon, main a failure to passage meconium after 48 hours after the birth, ribbon like stool. Most serious complication is Hirschsprung disease is इंट्रोकोर्टालाइटिस. क्या होता है? इंट्रोकोर्टालाइटिस. Telescoping of one part of the intestine is into another position is unto susception, that is clinical manifestation. Cochlear, abdominal pain, bile contact, fetal amniosis, jelly like stool. telescopy of one part of the intussusception and another portion in intussusception, that is clinical manifestation coeliacally abdominal pale bile contain fissile amnisis, jelly like stool. Hernias is protrusion. Hernia is protrusion of in organ part of organ from its original incision. Omphalosynthesis. Ompha- Omphalosynthesis is congenital abnormality hernia. Hernia part should be covered by sterilized moist gauze. Vitis platus are clinical manifestation are oral thrust causes by Candidus albicus. Vital pelagius are clinical manifestation or oral thirst causes by Candidus albicus. Sickle disease is allergy reaction to gluten portion is which increase level of glutic acid level, which is toxic for abdominal wall that causes impaired aspiration. Lead pointing this cano as a pulimism. Antidote is calcium disodium. Editatus and gelatination therapy. Antidote for organophosphate poisoning, atropine sulfate. Congenital heart disease including ASD, atrial septal defect, VSD, ventricular septal defect, patent ductus arteriosus, एट्रोवेंटिकुलर कैनाल AVS का मतलब होता है एंट्रियोवेंटिकुलर कैनाल. दिस आर क्लिनिकल मैनिफेस्टेशन बाय डिस्पोनोरिया, पाल्पिटेशन, टेकिकार्डिया, टेकिपनिया, रिकरेंट चेस्ट इन्फेक्शन, ग्रोथ फेलियर, साइनोटिक हार्ट डिजीज इंक्लूडिंग TOF, टेट्रालॉजी ऑफ एलिट, tricuspid atresia, transposition of great arteries, sternus arteriosus, clinical manifestation by hypoxia, blue tender spellius with clubbing of finger. This is diagnosis by electrocardiography confirmatory. VDS is most common as cyanotic congenital heart disease. TOF is commonly cyanotic disease. It is including pulmonary valvular stenosis, right ventricular hypertrophy, ventricular septal defect, overriding of aorta, clinical manifestation by boot-shaped heart, rheumatic fever, inflammation of autoimmune disease, clinical manifestation by major criteria by zone carotidis, nodules, polyarthritis, subcutaneous nodules, erythema marginum, Bengal penicillium is disorder of Bengali penicillin. Bengali penicillin is drug of choice for rheumatic fever. Hydrocephalus is excessive abnormal accumulation of the CSF in brain due to imbalance in between the production and absorption of the CSF. Most common site in the cerebral aqueduct. Clinical manifestation bulging anterior fontanus, sternus and non-pulsation, cracked pout sound, McCone sign with high aspiratory cry due to increased ICP and seizure. Treatment VP shunt, ventriculoperitoneous shunt, AV shunt, ventriculoatrial nursing intervention provides supine side lateral position to decrease ICP. Spinal bifida neural tube defect, malformation of the spine. Most common side is lumbosacral region due to deficiency of folic acid. Meningocele is protrusion of meninges Myelomeningocele is protrusion is of meninges with CSF, nerve root and spinal cord. Most common type. Nursing priority: prevent injury and infection. Cover the sake with sterile moist non adherent gauze adherent gauze provide phone position. Toe walking and sunting gait is sign of the spasticity. RETTS syndrome is condition of growth and development is normally till 6 months, but after there is delay in growth of language and movement. MR is IQ level less than 70. Ray syndrome aspirin taken in viral illness में cause वायरल इन्फेक्शन में अगर बच्चे को एस्प्रिन दे दे तो वो रे सिंड्रोम कोज करता है. डायग्नोसिस: लीवर बायोप्सी. मैनेजमेंट: प्रोवाइड रेस्ट एंड क्वाइट एनवायरनमेंट, प्रोवाइड लो प्रोटीन एंड adequate choline, elevate head of the bed, given PCM for fever. Down syndrome, trisomy 21 combination chromosome disorder in children. Clinical manifestation look like a Mongolian rhesus, single palmar cry, simian crisis, infid wide gap between big and second toe. Infid wide gap in the big and second toe. Aspermia, absence of sperm. A लग गया मतलब absence of sperm. सीमन को अब्सेंट होने को बोलते हैं एस्पेरीमिया. ASPERE एस्पीमिया मतलब absence of सीमन. एजोस्पर्मिया का मतलब होता है absence of sperm in serum. एलिगोजोस्पर्मिया मीन्स 20 मिलियन से स्पर्म का कम होना है. पॉलीजोस्पर्मिया मीन्स 350 मिलियन स्पर्म से ज़्यादा होना है मेल से. नेकरोजोफिस्मिया 70% स्पर्म आर विथ abnormal morphology. एथेरोजोस्पर्मिया 25% से ज़्यादा स्पर्म आर नॉन मोबाइल. क्रॉप सिंड्रोम इज एक्यूट epigalactosis caused by hemophilia infused type B. Streptococcus is epigalactitis is suspected. No attempt should be made up to visual the posterior pharynx obtained through culture or take in oral temperature. Otherwise, sperm of the epigalactitis can occur, leading to the complete airway ejaculation. Solation preparation. Solution preparation should be implemented for hospital child with in upper respiratory infection. Utilize the cause of the infection is canoes. फिर है विल्स्म ट्यूमर VILM विल्स्म ट्यूमर या नेफ्रोबेलमेस ट्यूमर. मोस्ट कॉमन रीनल ट्यूमर. क्लिनिकल मैन्युफैक्चरिंग पेनलेस palpable abdominal mass in frank region. Fever micropic hematuria. Renal biopsy and administer palpation is contraindicate. Extrophysis or ballor production of the urinary bladder through the umbilical wall उसको बोलते हैं एक्स्ट्रोप्रोलैप्स और of bladder. Cover exposed bladder with sterile moist or non-adher gauze. Provide sideline supine position. Inu- Enuresis unable to control bladder function even though child has reached to vein control or void is expected. Sign drug of choice imipramine. Dysplasia of hip, partially or completely dislocation of hip or femur from acetabulum cavity. Clinical manifestation asymmetry of the gluteal and thigh skin fold. Ellis sign Gallis test Soter femur is affected side. Tenderberg sign downward pelvic on affected side. Most spinagiate of hip with pelvic hardness 6th month. Im- implant Impetigo is in skin infection caused by Streptococcus of beta hematolytic Streptococcus, most commonly affected face around mouth and neck region. इसको बोलते हैं इम्पेटो. Maintain contact precaution because it is highly contagious. Drug of choice is cephalosporiosis. Maintain contact precautions because highly contaminated causes of drug of choice cephalosporin. Eczema is a inflammatory of the skin due to allergic reaction. Psoriasis. Yes, cirrhosis is autonomous disorder characterized by excessive keratinization of skin manifestation by severe protrusions. Thalassemia coli anemia, Mediterraneous anemia, hereditary hemolytic anemia characterized by reduced in synthesis of Hb. Hemophilia is in inherent bleeding and coagulation disorder due to deficiency of plasma coagulation factor. Leukemia is persistence and uncontrollable production of the immuno and abnormal WBC. Most common leukemia is acute leukocyte leukemia. Craig rule: child dose weight in lbs बटा 150 डोज. यंगर रूल चाइल्ड डोज child एज इन ईयर बटा इज 12 अडल्ट डोज. फ्रिंज रोल चाइल्ड एज इन मंथ बटा 150 अडल्ट डोज. इंटीग्यूमेंट्री प्रॉब्लम स्केपिजीज परूटीज palpular rashes bluish into the skin. To determine the adequacy of fluid resuscitation, vital sign especially heart rate, urinary output, detect urinary output, adequacy of capillary filling and sensorium status and associated pituitary capillaries. Pediculosis capitis refers to infestation of the ear and skull with लाई पड़ जाना यानी कि जू है, उसको बोलते हैं पेडिकुलेसिस कैप्टिसिस refers to the infection of the hair is skull with lysis. Sickle cell crisis, vasoacculation crisis causes by scarcity of blood with clapping of the cell in the microcirculation. Ischemia and infection, manifestation, fever, painful sweating of hand, feet, joint or affected area, and abdominal pain. Splenic sequentation causes by pulling and cooling of blood in the spleen. Hypersplenism, manifestation, protection, anemia, hypovolemic shock. Hyperhemolytic crisis causes by the accelerated rate of the red blood cell destruction over a short time. Manifestation, anemia, jaundice, and reticulocyte. A plastic crisis causes by diminished production and increased destruction of the red blood cell triggered by viral infection or depletion of the folic acid. Manufacturing production, anemia, and pulper. Administer of mapidine. Administer mapidine for pain is avoid because of risk of नॉर्मेपेडिनिन इंड्यूस सीजर. जो ये नॉर्मेपेड्यून है ये क्या करती है, सीजर को इंड्यूस करती है. द मोस्ट कॉमन कॉज ऑफ टाइप आर फैक्टर 8 डेफिशिएंसी, हीमोफीलिया ए और क्लासिफाई हीमोफीलिया, एंड फैक्टर 9 डेफिशिएंसी, हीमोफीलिया बी और क्रिस्टीमेट डिजीज. A child with a bleeding disorder need to wear a medic altered baricetlated. Joint criteria for disease for rheumatic fever. Jones criteria for disease of rheumatic fever. Major criteria: carditis, arthritis, chorea, arrhythmia, marginum, subcutaneous nodules. Minor criteria: fever, polyarthrasia, elevate arthrocytes, sedimation rate of positive C-reactive protein, elevate prolonged RR. Intervention on electrocardiogram. Assessment of a child with suspected rheumatic fever. Induce accurating about a rectal sore throat, recurrent sore throat, because rheumatic fever manifested 2 to 6 weeks after in untreated or particularly treatment group A. Beta hemolytic streptococcus infection of the upper respiratory tract. Circumcision may not be performed on a newborn with epispadias or hypospadias throat. There are other surgical techniques used to repair this defect. The pediatric surgery may be performed using the foreskin for surgery reconstruction. Epispadias, dorsal placement of the urethral opening. Hypospadias, ventral placement of the urethral opening. Applying petroleum jelly to the bladder mucosa is allowed become is strained to the dry out in adhere to the bladder mucosa to damage the declined tissue when the dressing is removed. ये हो गई अपनी पीडियाट्रिक नर्सिंग. थैंक यू सो मच. अब हम CHN पढ़ेंगे. ये थी अपनी पीडियाट्रिक नर्सिंग. थैंक यू सो मच.